Most of the attacks have been by mentally ill patients, biting, scratching and kicking staff. Nurses have been punched in the face and security guards hit in the groin. The worst offenders, patients at the Westkoppies Psychiatric Hospital, followed by Chris Hani Baragwanath, Carltonville and Far East Rand.
We continue to put measures in place to empower healthcare workers on how to respond to incidents of attacks on staff at health facilities. So far, we've had about 61 incidents, majority of which can be attributed to mental health care users, while others relate to anger towards staff for various reasons, such as our staff refusing to buy patients' items or patients trying to escape.
Health Workers Union Denosa is concerned about the high number of attacks.
We are disturbed by the high number of incidents where healthcare workers have been attacked or injured by mental health care users. And we believe that this is part of a bigger problem which we have raised with the department on previous occasions and in other platforms as well.
The details of the attacks on healthcare workers came after a series of questions sent to Gauteng Health MEC.
It's really very distressing that there have been so many attacks on staff in Gauteng hospitals, particularly from mental health patients. Obviously, there needs to be beefed up security, but what I think we also need, particularly in the smaller hospitals, is dedicated psychiatric wards.
Gauteng Health says it's putting measures in place to deal with the situation.
Among the measures that we've put in place includes continuous training of staff in terms of how to deal with aggression and patients that are violent, improving the profiling of the patients themselves so that staff members attending to those patients have a better history in terms of what some of the underlying conditions.
Nursing Union Denosa is calling for a swift response from government.
We are therefore calling on the department to ensure that safety is adhered to at all times, and that they need to ensure as well that they put these mental health care users in places which are equipped to house them.
The union further says they will not stop fighting to ensure that the safety of all healthcare workers is improved and will continue to hold the health department responsible until they do so.